Hello and welcome to Coronavirus Catch Up. I'm Jordan Kenny. So 1 year ago, our lives were completely different, but on the 27th of February 2020, things were about to change. Have a look at this.
Hello and welcome to BBC Newsline. Northern Ireland has its first case of the coronavirus.
Just to confirm that testing of a patient in Northern Ireland has resulted in a presumptive positive test for coronavirus, that's COVID-19. I want to confirm that the patient is receiving specialist care and public health staff here are now working rapidly to identify any contacts the patient has had with the aim of preventing further spread.
That was the Chief Medical Officer, Dr. Michael McBride, speaking almost exactly 1 year ago to the day there. Back then, words like lockdown, social distancing, quarantine, furlough, they were things that meant very little to us, but now they're words that are part and parcel of our daily lives. I am one floor above our health correspondent, Marie-Louise, who joins me now to answer some of our questions and talk about what the past year has been like. Marie-Louise, it's almost unthinkable the way our lives have changed in the space of 12 months.
They really are. You know, here I am broadcasting from what looks like a cubby hole. It's actually the music library here in the BBC. As you say, you're on a completely different floor from me, Jordan, and that's just the way we do things now. We're all operating out of different floors, out of different rooms, and that all originates from what happened a year ago. It was a Thursday night. I remember it very, very well. I had gone on to Newsline 6:30. We broke the news that we had a positive case in Northern Ireland. It was always a case of when we would have and not if. And the woman, I remember the night at the time that the Chief Medical Officer said that, you know, the case that then we didn't know it was a woman. But we found out afterwards that the woman wasn't seriously ill. You know, she had symptoms. She had flu-like symptoms. She had travelled from Italy into Dublin and then had used public transport to come up into Belfast and to go home. And words, as you say, that night that have just become part and parcel of our daily language, talking about coronavirus, talking about symptoms. I don't even think at that stage we were talking about a lockdown. Or restrictions. And even that night where we had the press conference in the Health and Social Care Board, you know, no one was self-isolating because we didn't know then how the virus could spread. We weren't wearing masks. We weren't socially distancing. And just think of all those things that we do naturally now. And I'm sure, like me, when you see people going to move very closely to each other on the television screen, you actually do stand back and, you know, you say, no, don't do that. It's just become part of our lives now. We take it for granted.
Well, that first case, Marie-Louise, on the 27th of February last year, that made up 16 cases across the whole of the UK. Since back then, in February, we've now had over 111,000 cases of coronavirus in Northern Ireland. What do you make of those numbers?
They're just phenomenal, aren't they? As you say, that woman's case made up one of 16. Now we talk about millions of cases. And even, Jordan, if you look at today's figures, I was shocked to see that it was around 281 people today tested positive for COVID in Northern Ireland. They're the ones we know about. So we're still talking in hundreds. It's not that long ago that thousands of people were testing positive. We've got it down to 281. Hopefully that figure will continue to come down. You know, last summer, that figure was just down to a handful. It was amazing, incredible to have the figures so low. And that's why experts would say Northern Ireland was at such a great spot this time last summer because we had our figures so low. And then, of course, we opened up again. We had eat out, dine out. We had all those different schemes. And of course, very quickly, the figures started to creep up again.
Well, earlier today, Marie-Louise, you met the Health Minister, Swann. What was the mood there?
Yes, we did an interview with the Minister on the basis that it was 1 year on from the first COVID case. The Minister was extremely busy. He basically squeezed myself and my cameraman in for really a half an hour. He had just come from the executive meeting where they are trying to get this deal forward, the plan, our Northern Ireland's exit plan. He was, I felt, pretty stressed, downbeat even. He was obviously very, very tired. And he just said, it has been some year, and it wasn't just about himself. He was talking mostly about people in Northern Ireland. He said he felt very responsible for every single person in Northern Ireland, and among his biggest regrets are the sacrifices that people have had to make. That interview will be going out across all outlets tomorrow, Jordan, and there's some very, very interesting aspects. A small hint of what might lie ahead in a couple of months. He's a minister that doesn't give very much away, and he said he was, all respect to the Northern Ireland executive, they still had to sign off on the way forward, and he wouldn't be preempting any of that.
Well, that's something that we'll look for tomorrow, Marie-Louise, across the BBC News NI output. But for now, let's get to some of the questions that have been sent in by our viewers. We'll start with this one from Shay. So Boris Johnson obviously announced earlier this week the roadmap out of lockdown for England. According to that plan, all legal limits on social contact will be lifted there by the 21st of June. If, of course, strict conditions are met. So that means, nightclubs will reopen, large music events like Reading and Leeds Festival have announced that they're going ahead. Many people, Marie-Louise, are starting to plan these larger events. So Shay's asking that since case numbers here are falling again and the vaccine rollout does seem to be going well, can we expect more normality in Northern Ireland by the summertime?
Okay, so if you're talking about the summertime, Jordan, I think dates are very important. And even though the minister and officials have been saying it's not about dates, it's about the data, obviously we all want to know when we might be able to go out and enjoy a meal with friends. The minister and the chief medical officer have hinted very, very strongly that come this summer, we will be able to do some of the things that we enjoyed last summer. But that could mean booking a restaurant again and perhaps being given a table for 2 hours and nothing more than that. And we'll have to exit again. You may not at that stage be able just to call into a bar for a drink. You will only be able to go into a bar that's serving food, again, reserving a table for 2 hours. There will be changes compared to what we are currently living in. A lot of those restrictions will have lifted. But if you're thinking of normality, of just being able to walk into town or walk down to your local pub and call in, I would be very surprised if we will have moved that far by the summer.
Well, moving on to vaccines, we've had this in from Lindsay, and she's asking, from a medical point of view, is there anyone who should not have the vaccine?
Yeah, there are 3 groups of people who are advised to think very, very carefully about getting the vaccine. As we know, children at this stage aren't getting the vaccine. There are trials going on at the moment in England where they are starting to explore if those under 18 can be vaccinated. So that's one group. The other group where the advice is to think very carefully because the research isn't properly known about this group are pregnant women. Now, I was speaking to a GP earlier on before we came on air, Jordan, and they said there have been several women across the UK who are pregnant and who have received the COVID jab. So basically, it's up to you. The problem is that they haven't trialled the COVID vaccine yet on a pregnant woman. And then the third cohort of people are those who are known to react, to have an allergy to some of the ingredients that are in the vaccine. Again, your GP should be able to talk it through with you about that if you have very strong allergies. And of course, you will know by then what is in either of the vaccine.
But obviously, Marie-Louise, if you don't fall into those categories, you're strongly encouraged to get the vaccine. Is that right?
You are strongly encouraged. And I was talking to a group of young people yesterday. When I say young, they were in their early 20s, some of them looking forward to getting back to university again from Northern Ireland, travelling over to England. And some of them said, I'm 21, I'm healthy, should I get the vaccine? And by late summer, September, October, what we're told is if a person 21, 23, if they're offered the vaccine, yes, you should take it, because you could still find yourself in a university environment or out in a pub or restaurant where you could become infected by someone else. You could become very ill. And of course, you could carry the virus home to someone else who perhaps is more vulnerable, because at this stage we still don't know for sure. While the vaccine does offer 75% of protection, we still haven't been living with this vaccine long enough to know for sure the length of time that people are fully protected.
Well, you mentioned students there, Marie-Louise. We've actually had a question in about that. This is from David, and he's asking about students from Northern Ireland who are currently studying away from here. So if you're a student studying away from Northern Ireland, where will you get the vaccine when called? Could you, for instance, get one dose at university and one dose at home?
Yes, apparently you can. I was talking to a group of students, medical students as well during the week, and one of those students had got their vaccine while working in one of the vaccination centres in Northern Ireland, but is due to return back to England to finish another part of her medical degree, and she was inquiring whether or not she could get the second jab whenever she returns to Glasgow, and the answer is yes, that as long as you bring your card with you, which shows which vaccine you've got your number and your name, you can certainly pick up that second vaccine somewhere at a different location.
Well, face masks, Marie-Louise, they're something that going back a year ago, most of us probably didn't own. I certainly didn't have one. But now everybody has a face mask. And on that, Luke, he's got in touch with us and he's asking, will we have to continue wearing face masks and social distancing even after the majority of us have all been vaccinated?
We don't know the exact answer to that. And someone was asking me today that there are concerts, for instance, due to go ahead in Belfast come in August. And my feeling and understanding about that at the moment, and the guidance that has been given by the Chief Medical Officer and the Chief Scientific Advisor, is that it could be many, many months before any of us are in large gatherings, like in a concert venue, even in an outdoor concert venue. Even a wedding, they could say that weddings could be restricted to perhaps 100 people if you're outside in a marquee. And the hook on that might be that you have to continue to wear a mask. I imagine in places like public transport, in supermarkets, perhaps even some workplaces will insist that people will have to wear their masks for a little while longer, because we still don't know the outcome of what might happen to some people once they get the two vaccines. Governments will want this to bed in. They will want to see evidence and proof that people are well, and that there will be certain areas where we will continue to wear masks, particularly in public places, like, as I say, supermarkets and in public transport.
Well, today was a milestone day for the vaccination programme. Over 500,000 people in Northern Ireland have now received a COVID vaccine jab. But over 30,000 people in Northern Ireland have now had both jabs of their vaccine. Julie is asking, if you're in that group, so you've had both your first and second jab of a COVID vaccine, do you still need to isolate if you're contacted by track and trace and told you're a close contact of someone who has tested positive?
Yes, you do. And that's one of the things that are emerging. You know, even though people get the first dose, then they go on to get their second dose. I actually know someone who, after a first dose, tested positive for COVID-19. Now, their symptoms were extremely mild. It was almost like a bad cold. But until more research is gathered around people on trials, and the more and more people who have the first dose and then the second dose, and then there's a lapse perhaps of 3 months, nothing will be taken for granted, and people will still, I imagine, be continued to self-isolate for 10 days if you've become a close contact, yes, until more is known about the vaccine.
Okay, Paul has been in touch, Marie-Louise, on shielding. Obviously, last week it was announced the lockdown in Northern Ireland would be extended until the 1st of April. But Paul's asking, has shielding been extended with that? If not, when is it due to end?
No, shielding in Northern Ireland, like we knew it last year, ended many months ago. And people are being advised, if they prefer, if they feel safer to stay indoors, that they should continue to do so. But it is really just general advice. If you don't want to go out into public places, or if you don't want to return to work because you still don't feel safe, you're not being told that you have to, but you are being advised once you get your vaccine, you are protected a little bit more than what you would have been previously. So we have not returned to those shielding days like we knew last year.
Well, lastly, Marie-Louise, before we go, if we learned anything from 2020 in the past year, it's that we can't really predict anything that's going to happen. But how do you see 2021 playing out for us all?
Well, who would have thought that once again, Mother's Day is going to come around, and we are probably going to be marking it in our own special way, like a Zoom call like this, perhaps visiting our mums or our grannies, in back gardens again. You know, we never thought that we would be going through this 12 months on. I imagine if the numbers keep continuing to fall as they are, this week over 4 days we had 16 deaths. Over the same 4-day period last week we had 25 deaths. So, the numbers are coming down. So long as that keeps happening, so long as hospital admissions continue to fall, that the R number remains low and below 1. Of course, all these things might change once schools start to open up again. And the next phase could be perhaps some retail shops, barbers. And every time one of those phases open, or one of those sectors opens, they are going to monitor hospital admissions. They will monitor the number of cases. They will monitor the R number. If those all continue to stay low, we will start to see, as each month goes past, a little bit more of normal society again. I imagine by the summer, yes, so hopefully we will be able to go out and enjoy a meal in a restaurant. I imagine we will probably have to vacate the table 2 hours in. And then perhaps come September, October, again, if the numbers remain low, facilities will be allowed to open up even more. But Northern Ireland, compared to the rest of the UK, seems to be taking, at this stage, a very, very cautious approach. The Minister said today it will be a cautious reopening, not a reckless one. And he seems to be a health minister who is sticking to his word on that it will be cautious and that he is putting every life first. And also, remember, Northern Ireland's health service was on its knees before the pandemic. It's even in a worse state now. We have a very tired health and social care workforce. All of those different factors are going to be brought into one massive pot and will determine how quickly Northern Ireland opens again. And then before you know it, Jordan, we'll be back around to winter time again. I'll be here talking to you probably. By then we could be in a studio together. And, you'll be talking about, has the virus mutated again? We're coming into winter again. They have already said that, they expect some of the restrictions to come back round again come winter 2021. But who knows?
Well, lots to take on board there, Marie-Louise, and hopefully some brighter days ahead for us all. But thanks so much for coming on tonight and answering those questions. We had some problems earlier in the live programme, but we got there in the end.
We got there in the end.
Perseverance is key. But we've had lots of questions sent in this week, so apologies if you did get in touch with us and we weren't able to get to your question. But hopefully the questions we did answer will have helped you make sense of what's happening this week and what's coming up in the days ahead. Don't forget, you can keep up to date with all the latest developments on the BBC News NI website, which you'll find at bbc.co.uk/newsni. And we're also on social media as well. We're on Facebook, Instagram, Twitter and YouTube. Just search BBC News NI when you get on there and you should find us. That's it from us for this week. We'll be back again next week live with another coronavirus catch up. But until then, stay safe.